Hi, everyone. We're gonna give everybody a few minutes to join. And then, is everybody seeing themselves right now?
Yes.
Okay, great.
Hi, Katie.
Hello.
Remember me?
I do. Yes, I think so. Maybe. Hi, everybody. Okay. We're gonna give it another minute for people to hop on because we know sometimes it takes a minute for Zoom to get up and running.
Hi, can you guys hear me?
Yes.
I cannot figure out how to get my camera on. I'm using somebody else's computer, so I will keep attempting to do that. I'm sorry.
No worries. That's what the initial meetings are for, is
Oh, I
figuring
think I
it
figured
out.
it out. There I go.
Awesome. Okay. Um, All right. Okay, can everybody see the PowerPoint presentation on the screen? Great, I'm seeing nodding heads. Okay, fantastic. Um, let's go ahead. Okay. All right, I think we can go ahead and get started. Welcome everybody to the very first meeting of our OHP Bridge Advisory Committee. My name is Katie Waldo. I use she, her pronouns, and I am the lead staff member for the OHP Bridge Advisory Committee and also the lead project manager for OHP Bridge as a project. So today is our very first meeting. We're going to meet all of our inaugural members and introduce some of the key staff. And we're really excited to have you all on board. I will go ahead and get the slideshow going. So before we dive into our agenda today, I just wanted to highlight a couple of key accessibility options that we have for you and also just some border baseline etiquette for everybody. The first is that closed captioning should be available for all attendees. It should be on the lower right-hand side of your screen, and I believe we are also starting it ourselves. But just wanted to make sure that you're all aware of that. And then as far as general etiquette goes, please do raise your hand before speaking. Our members and our staff will be the primary people speaking today, but we will have an option for public comment at the end. So if you can raise your hand, it'll help us keep track of who's involved and who's looking to speak. We also have we will be using our mute button if you are not speaking, but you're off mute and there's background noise. So we just want to make you aware of that. If you see you suddenly go on mute and you weren't before, just to make sure that it's easier for people to hear what's going on and just for accessibility reasons. The other thing we want to note is we do have a chat option today that it is set so that you can only chat with the hosts, and that is Melissa and myself. And that is, again, just to make sure that it's easier for people to be tracking the conversation. The last thing I do want to note is that we have a broad range of experience coming onto this committee. And so we ask that everybody be respectful of the different experience and perspectives that people are bringing. Some individuals are coming in with a lot of both policy and committee experience. And for others, this is sort of the first time that they're interacting with state policy or on a state committee. And so just keep that in mind as people ask questions. Are there any initial questions about etiquette and accessibility? Okay. We will go ahead and jump into the agenda. So we do have a packed agenda for you today. To start, we will be doing some introductions, both of key staff and of our new OBAC members. We're very excited to meet you all. And then we'll be diving into a presentation on OHP Bridge itself, as well as current operations. So again, we know that everybody's coming in with a different level of experience with this benefit package. So some individuals have sort of been working with us for a while on this benefit, and others are hearing about it more recently. And so we want to make sure that everybody's starting with a similar background and foundational understanding. We'll then be taking a quick break before we dive into our committee rules and operating procedures. And so we'll be kind of running through how the committee works, the expectation of our members, and then some opportunities for members to be influencing those two things. We will then be doing an election of our co-chairs. So this will be the only meeting where I'll be doing a majority of the facilitation. And in the future, that will be your co-chairs who you will elect today. And then we'll be closing out with public comments. So these are public meetings, and so there will be an opportunity at the end of every meeting for our co-chairs or for our community to offer statements in the form of public comment. So with that, we're going to go ahead and dive into our introductions. And actually, before we do that, I did want to lay out again for anybody who might be listening in today and who is just learning about the OBAC now, we wanted to kind of outline what the committee member makeup looks like. So we do have 2 community members, and then we have 2 healthcare providers, 2 representatives of healthcare organizations, 2 member advocacy representatives, 1 health equity specialist, a community navigator and a sister representative, and a tribal member representative. All of the seats I just listed are voting members. So they will be voting on recommendations that are put forward to the agency that come from this committee. We then have 2 leadership representatives, 1 from OHA and 1 from ODHS. These are non-voting seats, but they are here to help provide sort of the perspective of the agencies and help give that context. There is also the potential option in the future for OHPB to put forward a member representative if they feel that would be a good fit. Okay, with that in mind, we're going to go ahead and do a round of introductions. We'll be doing both staff introductions and members. And so we'll go ahead and start with our members. And we're going to ask that you please share your name, your preferred pronouns if you feel comfortable doing so. The seat that you are filling, again, if you feel comfortable sharing that. What county you're from, and your organization and role if you feel that's appropriate to share. And then ideally one thing you're hoping to learn from your term with this committee. So we'll go ahead and go down as the names are listed on the screen. So we can start with Debbie if you are online.
Hi, everyone. Debbie Cabrales. My pronouns are she, hers, ella. And let me see. I am from Marion County with Centro de Servicios para Campesinos. And I am hoping to just gather as much information as I can from everybody to learn how to better give resources to my community. Thank you.
Thank you so much, Debbie. Mike?
Thank you, Katie. Morning, everybody. So I'm Mike Durbin. My preferred pronouns are he, him, his. I am from rural Oregon in Douglas County. My current role is Clinical Operations Chief of Staff for Viva Health. It's an FQAC. And the one thing I'm hoping to learn most from this committee is how we can ensure that we can take care of as many people as possible with as many services as possible in our communities.
Fantastic. Thank you, Mike. Jonathan?
Hi, I'm John Hall, he, him. I am a dentist at Neighborhood Health Center. I'm also the chief dental officer there. And that's we have some clinics, and I see patients in Clackamas County, in the Portland area. One thing I'm hoping to learn, I would just love to learn how we can just provide more access for bridge patients and ultimately for all Oregonians.
Fantastic. Thank you, Jonathan. Angelica?
Hi everyone, my name is Angelica. I use her, she, her, ella pronouns. I work with Rockwood CDC as the department manager for our health department, but I'm also OHP assister. So we work in the Multnomah County. And one thing I'm hoping to learn with this committee is just seeing how we can all collaborate together and continue to help the community. Thank you.
Great. Thank you, Angelica. Renisha.
Thank you. I'm Renisha Isom. I work for Project Access Now as the Insurance Enrollment and Payment Support Program Manager. I have been an assister for almost 10 years. It'll be 10 years in January. But I look forward to just being able to bring the voices of our clients that are currently on this program and those who can transition to the program to this group and just see how we can expand like the word about the program to further.
Perfect. Thank you, Renisha.
Mhm.
Nora.
Hi, Nora Leibowitz, she, her. I am Care Oregon's Chief Medicaid Programs Officer, and came out of a long history of working on Medicaid at the state level. And I'm really curious about how we can support the members that are going through life transitions, that are going from it basically back and forth between Medicaid and Bridge, and how we can make that as seamless for them in terms of the eligibility transitions, that care doesn't change, that we make that as smooth as possible. So I'm really excited to see how we can support that.
Great. Thank you, Nora. Michelle.
Hey, good morning. I'm Michelle Rasmussen. I'm a family medicine physician, so I'm one of the two healthcare representatives. I am Marion Polk County. Salem Health is my employment. I'm the Associate Chief Medical Officer, so I'm mostly supporting all of primary care. I'm honored to be here. I really believe in that all people should have healthcare regardless of income. And so thank you for having me here, and I hope to serve well with all of you.
Perfect. Thank you, Michelle. Askina.
Good morning. My name is Askina. I'm Operation and Program Director at African Youth and Community Organization. I'm just here to learn how to have accessibility or to have access for healthcare. My role as a program director is to make sure that everybody deserves healthcare, that is healthcare for all. And I'm very passionate about social determinants of health, and I think this role will help me navigate through that so we can have healthcare for all Oregonians, regardless of their income, as Michelle has mentioned. Thank you.
Fantastic. Thank you, Askina. Nathan.
Good morning. My name is Nathan Smith. He, him, his pronouns. I am a licensed clinical social worker. I've been in the field for about a decade. I come from Indiana. And one of the things that I want to learn is how to make access to mental health services easier for LGBTQ, two-spirit, non-binary patients that are trying to navigate services.
Perfect. Thank you, Nathan. Brandon.
Morning, everybody. Brandon Tupper, Patient Registration Manager for Klamath Tribal Health and Family Services. I've worked here for 12 years, also a tribal member from my community. And what I'm hoping from everybody and learn from this committee is how this OHP bridge will better serve our tribal patients, because we have had a few transition from OHP basic Medicaid to this plan. So and as usual, there's always questions with that, and even from our own internal other workers, or like our pharmacy is having some issues and questions regarding this plan. So I just hope to help everybody and bring that tribal perspective to this group. Thank you for everybody's time, or for my time.
Thank you, Brandon. Kelly.
Hi, my name's Kelly. She, her are my pronouns. And I'm filling the seat of the community member. And I don't mind sharing. I have been on OHP, not the Bridge program before, but just OHP before there was the option of the Bridge program. And I found it complicated to figure out what CCO I needed to be in to see my provider, and what should I do if my provider, one of them's in this CCO and the other one's in this CCO, and I have kids, and it personally, I found it very complicated, and I enjoy health insurance, everything health insurance, and I'm not sure, it's just a strange passion that I have. And I've had personal experience from, family members that are older who I just don't want to deal with it. And I feel like a lot of people are paying money. I know somebody who's an older person who's says, I don't have any money. And it's like, well, you could get on these services and you wouldn't have, but they just, I don't want to deal with it. It's too complicated. So just maybe helping people, more people, make it easier for them to get services.
Perfect. We're really excited to have your perspective, Kelly. Okay, I believe that is all of our members. Before we dive into staff introductions, we do also want to request, if you are a member, if you could have your screen, your camera on, if you feel comfortable doing so. It just helps us be a little bit more interactive with you all. So we do understand if you're not comfortable doing so, but would like to put that request forward. Okay, we're going to introduce a couple of key staff members now. I'll kick it off just one more time. My name is Katie Waldo. I use she, her pronouns. As I mentioned, I am the lead staff member for the OBAC. So a lot of you have already begun to interact with me and will be hearing more from me in the future. I've been with OHA for about 2 years and predominantly work on OHP Bridge. So I'm really excited to do this with you all. Okay, I will go ahead and pass it over to Tim Sweeney, who is our policy lead.
Good morning, y'all. I'm Tim Sweeney. I am a policy analyst in the Office of Health Policy at OHA. I've been at OHA for about 8 years and worked on a variety of policy issues and initiatives that mostly focus on coverage. And over the last 2.5 years, have been the policy lead for our work to develop OHP Bridge. And so have been really working with this program since throughout the process that we'll go over in terms of the background, when this was legislation introduced, directing the agency to build this program, throughout staffing, outside advisory bodies, the task force, and all of the other work that we've done over the last 2.5 years to get to this point. So I'm really excited to be here and helping staff this committee and helping provide information to y'all, so y'all can offer some really insightful guidance to the agency as we continue to implement this program. So thanks for having me.
Great, thank you, Tim. Laurel?
Hi, everyone. Laurel Swerdlow. I use she and her pronouns. I served as the OHP Bridge project lead during development and the initial phase of implementation of OHP Bridge programs. I currently serve as the lead for the Office of Health Policy coverage team, which includes this OHP Bridge broader project, along with single payer work and our work with Healthier Oregon. I'm really excited to see you all here and to dig in with all of you as we continue to go down this path of implementing the programs. And I'll hand it over to Melissa.
Thanks, Laurel. Hi, everyone. Melissa O'Truman. I use she, her pronouns. I've been with OHA for about 8 years, and I have dabbled in a lot of different work. And I've been with the OHP Bridge project for about a year. So I kind of got in right when we were getting ready to launch, but it's been really exciting, and I'm happy to be here and happy to see where this goes. So I will hand it back to Katie.
Great, thank you, Melissa. And I think we have Jewel online.
Hey, yes, this is Jewel Kallstrom. Sorry for taking a minute. I am the business director with the Oregon Health Authority's Medicaid integrated eligibility unit. So I work specifically with a group of policy analysts that manage OHP and Bridge program eligibility rules and policies. I'm happy to be here. Thank you.
Great, thank you, Jewel. We also have Nikki, who's here as our OHA leadership rep. Nikki, are you
Yeah, I'm here. Thanks, Katie. Hi, folks. Nikki Olson. I use she, her pronouns. I'm the interim deputy of the division that did work to kind of pull together and launch this. It's called the Health Policy and Analytics Division. And as you're probably hearing through the staff introductions, all the folks from the agency are here working with you today have been involved in the design and launch of this program pretty much from the beginning. So this is a really big moment for us as the folks in the agency who have been spending the past couple years moving through all the steps it takes to realize a program, and now being able to connect with the providers and the community and the people impacted is really what all that hard work is for. So it's an exciting moment. I heard a lot of folks being ready to collaborate and serve the community, and I couldn't be happier about that being where we all get to be together doing this work right now. So thank you for your time in forming this committee and thinking collectively with all different perspectives about how to best serve the population.
Great. Thank you, Nikki. Okay, so we are going to go ahead and dive into some background and operations. As I mentioned, everybody is coming in with a little bit different level of experience and familiarity with this project and this benefit package. And so we want to make sure that you all have the chance to start from a common foundation. So I will be handing it over to Tim to walk you through this section.
Great. Thank you, Katie. And we have a decent bit of time before we break. So I may go through this more slowly than is necessary, but I just want to make sure that really everybody, regardless of how much y'all have followed this or know about this, can all get up to speed to the same place. So we're going to go through a little bit of the history and the development of the program, in addition to some of the overall structural pieces of the program. And certainly there will be more of this in coming meetings. So this certainly isn't the only chance to learn about the nuance of the program itself as we move forward. So starting with the history, back in 2022, when the unwinding of the public health emergency was imminent, the state knew that a lot of people were going to go through Medicaid eligibility renewals at once, and we wanted to, the legislature, the governor's office at the time, the agency, really kind of all agreed that we wanted to maintain the health insurance coverage gains that Oregon has experienced as much as possible. And so specifically, there was some analysis that looked at a population cohort with income between 138 and 200% of the poverty level, basically above Medicaid, traditionally eligible for marketplace tax credits, but also traditionally the highest rates of uninsurance of any income cohort in the state. So the legislature, in looking at that issue, directed OHA, directed the state to develop a bridge program to cover people in this income cohort who regularly were churning between OHP coverage, between Oregon Health Plan coverage and the marketplace, or sometimes between OHP coverage and not having any health insurance coverage at all. And so the state directed OHA to create a new program and laid out a variety of goals and a process to do so. And the first thing was the creation of the Bridge Healthcare Program Task Force, which was legislatively appointed, appointed by the governor, but established as a joint legislative task force. So it included legislators and representatives from both the healthcare delivery system, from insurance carriers and CCOs, from community members, from assisters, navigators, and to really think through the broad, high-level design of a program and the goals of the program. Throughout the development of this, after the task force produced its recommendations that really guided our work to build the program as it is, we held regular meetings with CCOs and commercial carriers to understand the issues. There were regular public conversations with the Oregon Health Policy Board, getting to, again, the place of the design of the program, and ultimate approval of the policy board to move forward. Worked extensively with CMS, the Center for Medicare and Medicaid Services in the Federal Health and Human Services agency to get approval for the program and secure federal funding for the program. Extensive work publicly and internally around crafting the rules in the OAR, in the Oregon Administrative Rules for the program. And throughout that time, there was extensive public engagement, both directly and through a variety of committees that had public comment and public conversations to set up the goals and structures of the program. So the authority, the OHP Bridge has authority in two different places. And we'll talk a little bit more about this. There are kind of two components to the overall program. There's two programs within it. So thus, there's two spaces where we have federal approval to use federal dollars to operate this program. And those two are a 1331 basic health program blueprint, and part of the program is delivered or is authorized through an amendment to the state's broad 1115 demonstration waiver. So Section 1331 is a part of the Affordable Care Act that sets up the federal rules for what's called a basic health program that is specifically designed to serve the income cohort, 138 to 200% of poverty, that the legislature directed OHA to serve with this program. And the direction to use Section 1331 also came from the joint task force that met throughout 2022. And so Oregon crafted what's called a BHP blueprint that sets forth to CMS the structure of the program, and CMS approves that blueprint and enables the state to get federal dollars. Separately, there's a demonstration, or there's an amendment to our 1115 demonstration project, which authorizes OHP Bridge Basic Medicaid, which we'll talk a little bit more in a second, but those are where we get to the two sort of separate components. One is a Medicaid program and one is a basic health program. So the next slide, now we can dive into like what these two programs are and what the distinction is. So the first one, OHP Bridge Basic Health Program, is where most OHP Bridge members will be enrolled. This is a program that is designed broadly to serve this population of 138 to 200% of poverty. This program is managed exclusively through CCOs, and that is due to federal requirements for the structure of the program. There is not the typical open card fee-for-service option that we have in Medicaid, which really is why the second program is created as well. OHP Bridge Basic Medicaid, in using the Medicaid infrastructure, is how the state is able to maintain the same mandatory managed care exemptions for American Indian Alaska Native members that exist in Medicaid. If we only had OHP Bridge Basic Health Program, we wouldn't be able to do that. So we created this OHP Bridge Basic Medicaid that creates a new Medicaid category that looks exactly like the basic health program from an eligibility standpoint, except for it is for individuals who are American Indian Alaska Native. And by offering this program through Medicaid, those individuals can choose to enroll in a CCO or can avail themselves of their federal right to opt out of mandatory managed care. So there is an open card component to basic Medicaid. And we'll go into a little bit more detail about some of these and offer some enrollment information about the two programs. But this is the fundamental difference in the two. Broadly speaking, if we're talking about services available, the benefit package, what rights members have to get services, the services will be the same between these two programs. But the authority is different, and obviously the right to opt out of managed care is different. So if I say OHP Bridge and that's it, then hopefully I'm talking only about like things that affect both of these programs together. And otherwise we'll try to be very, very clear when we're referencing something that applies only to OHP Bridge Basic Health Program, OHP Bridge BHP, or to OHP Bridge Basic Medicaid, or sometimes we'll just say Basic Medicaid. Okay, I wanted to make sure, sometimes that has, and no, you know, not surprisingly, that has been at times a difficult thing to really fully clarify, so we might spend a minute on that at other times, so I just want to make sure that's clear to everybody. Yeah, so the next slide is just a little bit more on the naming and branding of these two programs. And a reminder that the benefit package that is in our systems, in the MMIS system that determines what services an OHP Bridge member is entitled to, that benefit package is the same across these two programs. It's just how they're delivered, CCOs or with the option to not deliver them through CCOs. Okay, so moving on a little bit to something that is more specific to OHP Bridge Basic Health Program. And in saying that, I guess I will just say, OHP Bridge Basic Medicaid is funded as any other Medicaid program is funded. The state puts forward dollars, it is matched by federal dollars, and together those funds pay for Medicaid services, pay for OHP Bridge Basic Medicaid. Bridge Basic Health Program operates differently. There is a trust fund that the state creates to accept federal payments. And so for OHP, for a basic health program, the federal government will make a payment to a state that is based on the dollars that would have gone to those enrollees had they gotten coverage through the marketplace. So there is a federal formula that determines how much Oregon is going to get to operate OHP Bridge BHP that is based on the cost of marketplace plans and then the number of people we have enrolled in the program. And so at a broad level, the state is sort of entitled to federal funding based on enrollment. From a process standpoint, what happens is that every quarter, the state will send to the federal government an enrollment estimate of the number of people that will be enrolled in the program, where they live, some information about their income level, because that kind of helps determine funding, information about their family size, because again, that determines funding. And so we will send this information to CMS, some estimates of who's going to be enrolled. And then based on those estimates, Oregon will get a deposit, will get funding from the federal government to cover the costs of the program for those 3 months. At the end of those 3 months, Oregon will then compile who is actually enrolled and then send that information back to the federal government so that they can say, okay, did we pay you enough? Did we pay you too much? And it all kind of gets reconciled on an ongoing basis moving forward. So ideally, there's always sort of like money coming in every quarter to the state to cover the cost of this program based on who's actually enrolled. The majority of program costs are covered by these federal deposits, with the real exception being administrative costs. The state staffing costs to operate the program cannot be paid with these federal trust fund dollars, and any services, and then sometimes services that are not part of the CCO contract that federal funds can't be used for would also be paid for state dollars. And there are restrictions in some cases for federal funding. Oregon is required to designate a group of trustees, they're called, who are formally responsible for trust fund oversight. And one of the roles of this committee will be to make recommendations to trustees on things related to the trust fund itself, and especially related to to services offered with consideration of if there is adequate funding. So there will be conversations in this committee going forward about funding levels of the trust fund and the general financial health of the program that will help inform those discussions that y'all get to have and the recommendations back to the agency. Okay, moving on. So all of that is kind of like set up, and as of July 1st, 2024, Oregon launched OHP Bridge. Both programs went into effect on July 1st. You know, this is the new benefit for adults in this income range, 138 to 200% of poverty, broadly. According to federal, and some of these other pieces are federal requirements. This is a program for adults ages 19 to 64, for folks who do not have access to other affordable coverage. There is a requirement that if somebody has access to affordable employer coverage, and affordable is defined by the federal government, then they wouldn't be eligible for these programs. And then folks must have an eligible citizenship or immigration status to qualify. And just at a high level, that status is very similar, but not identical to the immigration requirements for Medicaid. It's instead based on immigration requirements for marketplace coverage, which in some cases is a little bit more broad. So sometimes folks who do not qualify, whose immigration status doesn't meet what's required for Medicaid eligibility, are eligible for marketplace tax credits, and so thus could be eligible for OHP Bridge, basic health program, or basic Medicaid, frankly, if they meet the other requirements. So one of the challenges and or just realities of creating a new program is that folks will join the program from different places. And so the biggest initial cohort of enrollment are going to be people who move from the Oregon Health Plan into OHP Bridge. And specifically, and I guess I'll back up a second. While the program was getting developed, Oregon got a temporary Medicaid expansion category put into our 1115 waiver that enabled folks who were going through the Medicaid renewal process and identified as having income that would eventually qualify them for OHP Bridge once that program was created. Folks in that scenario were able to stay on Medicaid, stay on OHP in this new temporary Medicaid expansion population. That saw folks go into that program back to, I want to say it was April 2023, which was when the first, when we got that approved and then when the redetermination started. And so from April 2023 through June 2024, folks who were going through their renewal, who were found to have income in this range, who in absence of OHP Bridge would have had to leave Medicaid and go to the marketplace, they were instead moved to this new temporary Medicaid expansion category. On July 1st, when OHP Bridge launched, folks in this scenario moved into OHP Bridge, and some moved into Bridge Basic Health Program, and some moved into Bridge Basic Medicaid, depending on their American Indian Alaska Native status. And from, on July 1st, basically, we had about 22,000 people move into OHP Bridge who'd been kept in this temporary Medicaid category pending the program's launch. Also, as of July 1st, some people who just had never gotten health coverage before could apply for OHP Bridge and get covered if they met all of the eligibility criteria. In addition to that, some people on the marketplace have income in this range. This is a population or an income cohort that would have been served by the marketplace before. And so as of July 1st, folks who have income in this range, who previously had marketplace coverage could move into OHP Bridge. So they could do that in one of two ways. One is they would go into their marketplace application and update their information. And that would, if the healthcare.gov system identifies them as eligible for OHP Bridge as in this income range, their information would be sent to the one system, the state's Medicaid eligibility system, and they would be notified that that's happening and that they may need to add more information to process their application on the one system. Or someone could go directly to the one system and apply for coverage. And in that application, in the way the system evaluates them, they would be evaluated for all health programs operated by the state. So they would get evaluated for Medicaid, and if they're not eligible for Medicaid, get evaluated for OHP Bridge, and then potentially would enroll in OHP Bridge at that time. So over the course of the next few years, people who currently have marketplace coverage will move to OHP Bridge. However, because they have to take action of some kind, it's not going to happen right away. There's no automatic moving of folks, and that's especially relevant, I think, in the middle of a plan year for folks who have had commercial coverage for the last now 9+ months, may have met their deductible, may be in the middle of a course of treatment. They're not automatically getting moved over to OHP Bridge. So as of right now, or as of October 1st, there were about 29,000 people covered by OHP Bridge. And as I alluded to before, the majority of folks eligible for the program will be on Bridge Basic Medicaid, about 28,000 folks on Bridge Basic Medicaid, and a little over 800 people are on OHP Bridge, 28,000 folks are on Bridge BHP, and a little over 800 folks are on Bridge Basic Medicaid. And so we expect the dynamic to roughly mirror this. Obviously, that share could change, but based on previous analysis, we don't think that it's going to change dramatically in the sense of the relative size of these two populations. Lastly, for my slides, there's, we're coming up on a time where we think there will be more movement into OHP Bridge. Open enrollment begins on the marketplace very soon, and more people will be going into their marketplace applications to look at options and could be identified as OHP Bridge eligible. And as such, there is going to be some outreach, there's some communications around this work to make sure people are aware of what's available to them, but also aware of their ability to not move directly into OHP Bridge if they especially are in the middle of a course of treatment, if they need to remain in their marketplace plan, some communication to make sure that they don't go into their application and update it to make sure that they can stay there. There is an ability in the marketplace to automatically re-enroll from one plan year to the next for some period of time, and folks have to have given the federal government some kind of permission to examine their information. But a large number of people do automatically re-enroll from one year to the next. So we do, again, back to that point of the movement will happen over time. We have already sent enrollment estimates for a couple previous quarters to CMS. We will be sending the next round of enrollment estimates to them at the beginning of November. And obviously, today marks a big milestone as well in terms of implementing the program in launching this advisory committee. and there will be more back to the open enrollment and outreach. That will certainly be a topic we continue to bring to y'all, and some more information about that work. I believe at the next meeting, and that will be again topics of discussion as we develop those strategies in the future. That is the end of my slide, and I know we have some time for questions before we do take a brief break. So really want to open it up to OBAC members for any questions you have based on what I went through, anything I didn't get to that you're super curious about, and we'll go from there. As folks are maybe thinking about, oh, great, I see a question. Jonathan, please.
I don't want to get too off track here, I guess. So if this question takes us there, we can certainly skip it. But I'm just curious. Thanks for going over the funding mechanism for bridge patients. I'm curious the difference between the bridge funding and the HOP funding. Is it similar, or is it pretty different?
I would say it's pretty different. HOP has multiple funding streams. There's basically a state funding and a Medicaid funding stream for Healthier Oregon, and I'm certain it's possible we have one of our Healthier Oregon policy experts on, so I'd be happy to defer, but I can at least say quickly, there's a braided aspect of Healthier Oregon that enables the state to take advantage of Medicaid dollars for Healthier Oregon members as appropriate. So emergency services in some cases, for instance, and others. But for the most part, it is a state funded program, and this deposit that comes from the federal government for BHP, there's nothing exactly like that for Healthy Oregon. There's some connection to Medicaid dollars, but we're not able to braid Medicaid and basic health program dollars in that same fashion. But I also see our esteemed colleague Devlin came on camera, so feel free to add to my explanation or correct anything.
No, that was great. Hello all, Devlin Prince, he, him. I work for the Oregon Health Authority in the Office of Health Policy with Tim, Laurel, Katie, and Melissa. Correct. The Healthier Oregon program is mainly funded through general funds from the government, and then there is some match funding from the federal government for emergency health benefits.
And I do want to note that we are only taking questions from OBAC members at this time. There will be a section at the end for public comment, just as a reminder. Do we have any other questions from our OBAC members? Okay. Well, we will be going ahead and taking a 10-minute break, and we will be coming back online around 11 a.m. So I'll put a reminder up on the screen, and everybody feel free to go on mute and off camera, and I'll see you back here at 11. It might take everyone a minute to get back to their seats, so we'll hold off for a few. Melissa, I think we can go ahead and restart the recording if you haven't already. Also, as we are having everybody rejoin the conversation, just a quick reminder that we are requesting that members have their cameras on if you are able and comfortable doing so, especially as we are going to be diving into some of the more committee-focused logistics and member responsibilities. So, okay, I think almost everybody is back. Okay. All right, we will go ahead and dive back in, everybody. We are going to start the second half of our first OHP Bridge Advisory Committee. And so we will be diving into the rules and operating procedures of the committee. So members should have received the operating rules and operating procedures document already. This has also been posted online. It is a draft document. And sort of before we kind of dive into talking about this more in depth, we want to highlight that today we've our staff and team have kind of pulled out some of the key items that we think you all should be aware of. However, we'll be diving into this document in more detail in our November and potentially December meetings as well. So we'll be kind of doing a high level overview and summary of the logistics and operating of the committee, but expect to have a little bit more in-depth conversation in the coming months. And we'll also be asking for more member feedback and input. So today is just kind of an introductory lesson in this document. So we're excited to dive in. Before we do look at more detailed pieces of that operating procedures, we wanted to just line out the overall committee purpose again for people who might be listening in and hearing about the committee for the first time today. And so the OBAC, or OHP Bridge Advisory Committee, is an advisory body that is charged with making recommendations related to our OHP Bridge benefit, and as well as our OHP Bridge Basic Health Program Trust Fund, which Tim discussed a little bit earlier, and our member outreach and communications. So those are kind of the three key areas that we'll be looking at as a committee and providing recommendations to the agencies related. As a kind of diving in a little bit more detail, we do want to highlight that the OBAC is a recommending body. It is not a decision-making body. So you all will be putting forward recommendations to our OHA and ODHS leadership, as well as our OHP Bridge trustees or trust fund trustees. So our executive agency leadership and our trustees will be making final decisions relating to OHP Bridge design, as well as operations and our trust fund spending, but they will be taking into account very heavily the recommendations that you put forward. We also want to note that in the build and design of this committee that it is not statutorily required. So for those of you who are maybe a little bit less familiar with policy, that means there isn't any legal requirement for us to stand up and launch this committee. But we felt as an agency that it was incredibly important for transparency. And as Tim mentioned in his section, it was also heavily recommended by our Bridge task force, which initially helped us build the design for OHP Bridge. And so we really wanted to make sure that this space was here for our community members and partners to help guide this new benefit package. That being said, in building it, we did take a lot of inspiration from our Medicaid Advisory Committee, our Health Insurance Marketplace Advisory Committee, and our Organ Health Policy Board. And so if you're involved in any of those or familiar with them, it might feel a little bit similar. We also want to send out a huge thank you to all the staff that lead those committees and that have provided us with immense resources as we try to build and design this committee. The last thing we really did want to highlight for you all is that while we kind of laid out in the previous slide what the committee does provide recommendations on, we also wanted to make it clear what we will not be discussing in depth and providing recommendations for. And so that the three kind of key areas that we will not be looking into in depth will be our marketplace affordability topics. We also will not be influencing traditional or providing recommendations on traditional OHP. There are committees and boards that do incredible work on that already, so we'll be focusing just on the OHP Bridge benefit here. And lastly, we won't be providing recommendations on sort of broad CCO system changes. So there will obviously be topics related specifically to how CCOs deliver and manage OHP Bridge specifically, and there will be spaces to provide recommendations on those things, those specific items and areas. However, kind of more broad CCO system issues will not be discussed in this committee. So just wanted to clarify that there will be a little bit of overlap there, but this isn't a broad system space. Okay, so now that we've kind of laid out the responsibilities of the committee as a whole, we wanted to dive into the responsibilities of our members. So all of these have kind of been laid out in that original recruitment notice that we put out, but we recognize that everybody came to the committee in kind of different avenues and through different paths. So we wanted to make sure that we line this out here as well. So the sort of right off the top, our OBAC members are expected to participate in all meetings. We recognize that there might be a situation where you're unable to do so, but we do want to highlight that if you do miss more than 25% of meetings in a year, that there is a possibility you could lose your seat. Obviously, there will be discussions with staff before that happens, but we will eventually only be having 4 meetings a year, so it'll be really critical that you're able to attend those. We also are requesting that you review the provided materials ahead of time. We recognize that for members, those got to you quite shortly before this meeting this time around. We promise that is not going to be the standard. And so we will be giving you enough time to really look into those materials. And that's just to make sure that everybody's coming into the discussion ready to talk about the things that we need to discuss and we're not having to spend a majority of our time sort of bringing everybody up to speed. So we will be sending those out ahead of time. And ask that you take a look at them. We also want to highlight that we are asking you to engage in policy level discussions about healthcare in Oregon. So we recognize again that everybody's coming into this committee with a really broad range of experience and level of familiarity with policy. And so we will do our best to make sure that we are presenting this in an accessible and understandable way. But we do want to make it very clear that that will be a key part of the conversation. So just to be kind of ready for that. Feel free to ask questions and make sure that we want to make sure you feel you can get the support that you need in understanding those policies, but just want to highlight that as a key part. We also ask that everybody here in the way that you engage in this conversation and consider recommendations, your vote, things like that, are really working to elevate the voices and perspective of OHP Bridge members. We obviously, we have members on the committee that are in roles specifically meant to represent OHP Bridge members, either as member advocates or as members or community members. And so while those specific seats exist, we are obviously all here to make sure that we're serving OHP Bridge members as a whole. So we ask you all to keep their perspectives and experiences in mind. We also obviously are expecting everybody to participate fully, respectively, and constructively. So this partially plays into what I discussed at the very beginning of the committee, which is that, again, everybody is coming into this with a wide range of experience, both with policy itself, with healthcare, and with being on state committees. And so we are asking that everybody keep that in mind. Individuals might ask a wide range of types of questions coming from those different experiences, and we ask that you remain respectful and understanding of that. Lastly, just from a more logistical standpoint, we are expecting members to need to spend approximately 1 to 2 additional hours on meeting months, just preparing for meetings. And again, that's kind of dealing with reviewing those materials that we send out, responding to emails that we might send ahead of time regarding the upcoming meetings, things like that. So just want to make sure that everybody's aware of the time commitment. I do want to pause just for a quick moment to see if there's any questions from our OBAC members regarding these responsibilities and expectations. I can't see anything in the chat, so I want to check, Melissa, is there anything in the chat that I'm missing? Okay, great, awesome. Alrighty, so we're going to go ahead and dive into the sections, kind of more into this protocols and logistics piece. So within the draft rules and operating procedures that were sent out and posted to the website, there's a section related to committee values and principles. And this is really an area that we'd like to extra emphasize for you all. This is a space we think would be great for our members to provide feedback and suggestions on ways we might be able to expand this. So currently what we've outlined is that the values that are expressed in OHA and ODHS's strategic plans will be the ones that serve and guide the committee in any recommendations that we put forward. So just to clarify for those of you who might not be familiar with these documents, both OHA and ODHS have agency strategic plans, and they are 2 documents. Each agency has their own. And within each of those strategic plans, they outline a set of values and principles that they are using to guide sort of their goals for the coming years. And so those are the values and principles that we're hoping you all will kind of keep in mind as you draft and consider and provide recommendations to the agency. However, we do want to note that we are excited to consider any additional values and principles that might feel appropriate for the role of this committee specifically. So what we're asking that you all do is over the next month, before our next meeting, that you take a look at those strategic plans and the goals and values that are, or values and principles that are outlined in those documents, and see if there are any that you feel are missing or that we should be adding into our document. And then bring those with you in mind for our next meeting to have a bit more of an in-depth discussion and put them forward. So just wanted to highlight that as an area that we're really excited to collaborate with you all. Okay, so more kind of, again, purely logistical items is specifically related to voting. So we actually will have our first vote today, but in the future, there will be a lot of opportunities to vote on the recommendations that we want to formally put forward as a committee to our OHA and ODHS leadership. As a general rule, we will be using a consensus recommendation making approach. So this means that we'll strive for a recommendation that no member is voicing an objection to, and that everybody agrees that they will not oppose. This is the ideal situation. This is what we will be aiming for in all of our votes. However, we do want to recognize that that might not be possible all of the time. And so in a case where consensus cannot be achieved, we will be requiring at least 70% of the vote in support in order to move forward as a formal recommendation. We do want to note that recommendations that do not meet that threshold will still be shared or can still be shared with agency leadership as a series of opinions. And included in that will be the thought process behind each of the different voting groups. And just to clarify for everybody, 70% is roughly 8 members. So that's assuming that we have all voting members present. And so any questions on the voting process? Okay, great. And lastly, before we move on to our first vote, just some really quick committee logistics for everybody. So our meetings—
I got a question.
Oh, Irma, just as a clarification, we will only be taking questions from our OBAC members.
That's what I wanted to know. Thank you.
Yep, absolutely. Thank you. So our meetings will all be held virtually over Zoom, at least for the first year. So we had some questions about potential for hybrid or in-person meetings, and we do just want to clarify that at least for the first year, everything will be virtual. We recognize that in striving for a geographically diverse committee, it also means that in-person and hybrid meetings can be a bit more difficult for everybody. So in order to maintain accessibility for everybody, we'll stay online for the first year, and then we'll be consulting with all of our members in the future to see if there's a desire for a hybrid or in-person meeting. So we're not saying forever, we're just saying for now, and then we'll work with you all to make sure we're hosting meetings in a way that works for everybody. For the first 6 months, we will be hosting monthly meetings, and they will be 2 hours long. That's just to help us get this committee up off the ground and moving. And then we will transition to quarterly, and those meetings will be 3 hours. So March will be our last monthly 2-hour meeting, and then in June, we'll have our first 3-hour call. Currently, meetings are set for the Wednesday of the second full week of the month. However, we have identified some critical scheduling conflicts related to internal staffing. And so in the new year, we will be transitioning to a different day of the month, and we will be reaching out to all of our OBAC members. Keep an eye out for a very fun doodle poll to find a time that works for you all. And so starting in January, we'll have a slightly different schedule. Lastly of all, we do want to highlight that these are public meetings. That means they will be recorded. The meeting materials will be posted, including the recordings, and we will have that public comment section at the end. So just wanted to make everybody aware of that. A public meeting notice will go out at least 48 to 72 hours before every meeting. And all of the information will be on our website so that people can join. So this is the last slide from our sort of logistics, rules, operating procedures section before we move into our election of co-chairs. So I wanted to pause and see if there are any questions from our OBAC members. Seeing shaking heads. I don't see any hands up, I don't think. Melissa, Laurel, am I missing anybody in the chat?
No one in the chat that I can see, but I did just want to reiterate. I think you said this, but just reiterating that we're going to be hoping that you all do eventually vote on these operating procedures, and that vote will be happening at either the next meeting or the meeting after that, depending on how the next meeting's conversation goes.
Yes, thank you so much, Laurel. That is, I definitely forgot to say that. And so that will be another one of our first official votes, and we're excited. We are sort of aiming for November, but we understand that it might take a little bit longer to really dive into everything. So December might be the final vote on that. Okay. In that case, we are going to move on to our election of co-chairs. So this role is outlined in the operating procedures that are posted on the website and has been sent to members. However, just to do a really quick review on what this position is, going forward, our co-chairs will facilitate the meetings. So this is the last meeting where you'll hear me talking as much as I am. And the goal will be that they facilitate the meetings in a way that encourages full and safe participation of members. They will also be collaborating with OHA staff to develop meeting agendas and establish subcommittees if needed. We don't expect that to happen for the first year or so, as well as ensure an efficient decision-making process. So they'll really be helping to facilitate that voting and consensus goal that we discussed a little bit earlier. Lastly, I just want to highlight that we are going with a co-chair approach as opposed to a chair and vice chair approach, which means that the co-chairs will be alternating facilitation responsibilities from meeting to meeting. They'll also be working together to make sure that all of the responsibilities that are listed in the position description are covered in the case of an absence. So with that being said, we do have, I believe, 4 people that put their names forward to be considered for the co-chair position. And we've asked that those interested, please say a few words on both introduce yourself and then say a few words on your experience and interest in the role and why you think you'd be a good fit. So I think we will start with Nora, if you are comfortable going first.
Sure. Hi. Thinking about my interest in this is, I guess, partially coming from what I would refer to as a deep policy nerdiness about good implementation of policy, and in particular, a lifelong focus on access to care as the main thing that I've worked on. And I would say that I think the value that I would bring to a co-chair role is related to having been on the staff side of this kind of group for a long time, kind of understanding how to work with staff and engage members and have kind of a collaborative process, which both is really important to me, and I understand is obviously the goal of an organization, an entity like this. And then my background, my personal work background, which has been focused on the Medicaid program and the Affordable Care Act. So that's partially where the nerdiness comes in, is some knowledge about how the program works and kind of what the federal guidelines are. And so understanding where we have the opportunities to weigh in and to make things as good as possible, and what the parameters are. So my current role is that I work for one of the CCOs. I work for Care Oregon, which runs owns 2 CCOs and is part of a 3rd CCO in the metro area. And so we have a really strong interest in making the program work for our members based on our overall organizational ethos of partnering for community and individual health.
Fantastic. Thank you, Nora. I think we also had Debbie.
At this time, unfortunately, I'm not planning on running to be co-chair, just because I have so much stuff on my that have since then appeared in my plate. So I'm sorry, but I'm hoping that someone else can definitely take this moment to talk about themselves if they want to. Yeah.
Thank you, Debbie. Michelle, I think you put your name for, did you? No, maybe not. That's okay.
This is my first experience on a board such as that, so I think I want to learn a little bit before I chair. So, but thank you.
Absolutely. Mike, I believe you were our 4.
All right, so I still want to potentially be co-chair, so I don't have to recuse myself, at least as of right now. A little bit of background. So I currently work for a federally qualified health center. For those who aren't aware of that, we're basically a safety net organization for individuals who can't really afford care. Our job is to make sure that people can get care regardless of ability to pay. As a result, a lot of our population is actually Medicaid. So we have a lot of direct experience with serving that population. You know, OHP Bridge is basically OHP. I also do have a little bit of background on the CCO side. I used to work for Umpqua Health Alliance, which is a local CCO here, where I was a director of contracting. Whereas part of that, I was responsible for our provider network. I also did serve as our clinically integrated network administrator for a short time, where I was trying to work with all of the providers in town, including the hospital and a couple other organizations, to make that work. In terms of kind of general values, I want to ensure that OHP Bridge members are able to receive the quality care that they deserve, like every resident of Oregon does. And I like to think my experience will help provide that oversight in terms of being chair for the board. Sorry, for the committee.
Fantastic. Thank you so much, Mike. Is there anybody else that would like to put their name forward to be one of our co-chairs? All right. In that case, we have 2 people that have put their names forward to be our co-chairs. And we will, does anybody motion to approve, vote? Oh. Thank you, Michelle. Do we have a second?
Second.
Okay. I think we will run through the names of our members, and you can vote yay or nay or abstain. So we'll start with the people I can see on the screen. Jonathan.
Yay for both Mike and Nora.
Fantastic. Kelly.
Sorry. Yay for both.
Fantastic. Nora.
I don't know if I need to abstain from voting for myself or not. Then yes, yay for yeah.
Perfect. Thank you, Michelle. Oh, Michelle, thank you.
Yay for both.
Okay, great. Mike?
Yay for Nora, and I'll abstain for myself.
Perfect. Brandon?
Yay for both.
Great. Nathan? Been there, Nathan.
Did not find that unmute button. Yay for both. My apologies.
No worries. Thank you. Debbie?
Yay for both.
Perfect. Askina?
Yay for both.
Thank you. Angelica?
Yay for both.
Thank you. Renisha?
Yay for both.
Okay. I think that is everyone. So in that case, congratulations, Nora and Mike. I'm very excited to have you both on board as our inaugural co-chairs, and we will be reaching out to both of you to go over the role again and get planning for our next meeting. Okay, thank you, everyone. We will go ahead and move into our final piece of the meeting, which is our public comment section. So just to kind of provide a bit of an outline on how this is going to work. The OHP Bridge Advisory Committee welcomes and deeply appreciates public testimony. We thank you all for taking the time to provide comments, and we are committed to profound listening and learning. Sometimes we may not respond directly to a comment during the meeting, but after the meeting, the chairs may review and discuss comments with staff to determine appropriate next steps. If there is a misstatement about factual matters, staff may offer clarification during the meeting. In any event, the committee will give you your comment our full attention and listen with respect. Each presenter will get 2 minutes to share, and in the event that doesn't feel like enough time, we do encourage you to provide written testimony, which we commit to reading. To keep us on time, we will start a slide with a 2-minute timer, which I'll put up here in a moment. For each presenter, we ask that you conclude your comments when the timer is complete. As you start your comment, please state your name and, if appropriate, your organization for the record. So far, we haven't had anybody email us to request public comment, but we do want to open the floor. I do want to note a couple of things. One of them is that this is not a question time, so we won't be able to respond to questions that you may pose, but we will note them down, and they could be used to influence future meeting topics and presentations. With that being said, if you are interested, I will stop sharing and pull up the timer. If you are interested in providing public comment, please either raise your hand or drop your name in the chat. I'll give it a minute. Okay, I'm not seeing any raised hands, so I will go ahead and assume that there are no public comments at this time. If you are a community member that is on the call and you're interested in providing public comment in the future, you can reach out to us in writing via our OHP Bridge email. We will also be in the future putting a link on our OBAC website where you can submit formal written and request public verbal comment as well. So keep an eye out for that. Otherwise, to my core team members, my internal staff, is there anything else you would like to add before we close today? Okay, great. Well, thank you all for attending the initial meeting of the OHP Bridge Advisory Committee. We're very excited to have you all on board. And thank you to all of our community members for listening in today as well. And we will see you all in November. Thank you, everyone.
Bye, everyone.